Introduction. Health assessment is an essential nursing function which provides functions for quality nursing care and interventions. It helps to identify the strength of the client in promoting health. Continue. Health assessment help to identify client needs, clinical problems to evaluate response of the health the person to health. Let's go into definition. Definition of health assessment. Health assessment is refers to systematic appraisal of all factors relevant to client's health. Give a second definition. Health assessment includes collecting subjective data through interviewing the client and obtaining objective data by physically examining the client. Health assessment is refers to the systematic appraisal of all factors relevant to the client's health or health assessment including collecting subjective data through interviewing the client and obtaining objective data by physically examining the client. Purposes of health assessment. Establish a database for the client normal abilities, risk factors, and any current alteration in function. Plan strategies to, to encourage continuation of healthy patterns, prevent potential health problems, and elevate or manage existing health problem. Together information regarding client's health to determine client's normal function to organize the collected information to identify the health problems to identify client's strength to identify need for health teaching provide the ho- holistic view of the client formulating conclusion or a problem statement such as a nursing diagnosis to collected data pertinent per, pertinent to the patient's health status example subjective and objective data to identify deviations from normal to paint out actual problems to build rapport with patient and family. Then type of types of assessment. There are four types of assessment. Then firstly initial assessment, second time lapsed assessment, third focus assessment, fourth emergency assessment, and then show it initial assessment. Types of assessment. Initial assessment, focus assessment, emergency assessment, time lapse assessment. Then initial assessment, it is performed within specified time after admission to a hospital. The establish a complete database for problem identification, reference, and future comparison. Nursing admission assessment. That's example of initial assessment. Nursing admission assessment. It is performed within specified time after admission to a hospital. That is called as nursing admission assessment. Focus or ongoing assessment. Ongoing or or focus assessment is ongoing process integrated with nursing care. Purpose The main purpose of ongoing or focused assessment to determine the status of a specific and to identify new or overlook problem. Example of focused assessment: hourly assessment of clients' fluid intake and output chart. Emergency assessment. Emergency assessment is life saving assessment. The major purpose of emergency assessment is save the patient or client life. That's purpose to identify life threatening problems. That's example of emergency assessment. A rapid assessment of person's airway, breathing and circulation during cardiac arrest. Sorry, example: a rapid assessment of person's airway, breathing and circulation during cardiac arrest. Third, time lapse assessment. Fourth, sorry. Time lapse assessment involves assessment several days after first initial assessment. Purpose Purposes: to compare the client's current status to baseline data previously obtained. Purpose: to compare the client's current status to baseline data previously obtained. Example of time lapse assessment: reassessment of a client's functional health pattern in a home. Method of assessment: the primary methods used to assess clients are observing, interviewing, examining. The primary methods used to assessment clients are: there one, firstly observe the patient and collect the data. Then interviewing method to collecting data. Then examining the patient, that's called as questioning patient, that's collect the data, that's called as method of assessment. Observing: firstly, observation is a conscious and deliberate skill that is developed on through and with an organized approach. ते पहिले सांगितले ना. Example: observing data. Client data observed through four senses, that is through vision, smell, hearing and touch. Interviewing method: an interview is a planned communication or conversation with a purpose. History taking. That's it. History taking. Examining: the physical examination is a systematic data or information collection methods that uses observational skill to detect health problem. The conducting the examination, the nurse uses techniques of inspection, auscultation,